So hello again. My name is still Ana-Marija Hristovska and I am an anesthesiologist from Copenhagen University Hospital, Hvidovre in Denmark. And I'm doing a PhD on postoperative orthostatic intolerance. And in this particular study, we wanted to see if morphine contributes to this condition. And let me start off by defining postoperative orthostatic intolerance for you. It is these symptoms of dizziness, nausea, vomiting, visual disturbances, feeling of heat, or even syncope when the patients go from supine to standing position. And this is of course not good because it can prevent early postoperative mobilization and increase the risk of postoperative complications. Sorry. So what we really need to do is to address this multifactorial etiology of this condition, because there are so many factors related to surgery that might potentially contribute, such as the stress response, anesthesia, hypovolemia, pain, opioids, and so on. So the aim of this particular study was to investigate if morphine is an independent pathophysiological factor. And we did that by enrolling 26 patients that had a pre and a post morphine measurements. During the measurement, they were mobilized, so they were supine, sitting, and standing, 3 minutes in each position, while we did a continuous non-invasive hemodynamic monitoring using Glitchko. And in between the measurements, the patients received 0.1 milligram per kilo IV morphine. And please notice that all of this is done prior to surgery. So in that way, we try to eliminate all the confounding factors of surgery. So what we found out was that prior to morphine, all the patients were tolerant. After morphine, 38% of the patients were intolerant, and 13% of them had severe orthostatic intolerance, which means that they could not complete the mobilization procedure due to intolerable symptoms. And we looked at changes in hemodynamic and tissue oxygenation variables. What you can see here is that the patients with severe orthostatic intolerance, those are the red lines, they had attenuated responses of mean arterial pressure and of heart rate. There was also tendency of reduced cerebral oxygenation, but this did not reach statistical significance. So we conclude that postoperative pain treatment with morphine might be a substantial contributing factor, and that this is probably through both central and peripheral pathways. So thank you very much for your attention.